In this video, we will cover atherosclerosis. Arteriosclerosis and atherosclerosis are sometimes used to mean the same thing, but there is a difference between the two terms. Arteriosclerosis is an arterial disease manifested by a loss of elasticity and a hardening of the blood vessel wall, more commonly known as hardening of the arteries. It is a normal part of the aging process and generally occurs uniformly throughout the arterial system. Arteriosclerosis happens when the blood vessels called arteries that carry oxygen and nutrients from the heart to the rest of the body become thick and stiff. Healthy arteries are flexible and elastic, but over time the walls in the arteries can harden, a condition commonly called hardening of the arteries. Atherosclerosis is a specific type or a pattern of the disease arteriosclerosis manifested by the formation of atheromas, that is a patchy lipoid degeneration of the intima. Tunica intima is the innermost layer of a blood vessel consisting of a thin layer of endothelial cells that line the lumen of all blood vessels. The primary role is to provide a smooth surface that regulates blood flow and prevents blood clotting. Lesions or plaques form throughout the arterial wall, lead to narrowing of the arterial walls due to buildup of atheromatous plaques, reducing the size of the blood vessels and limiting the flow of blood. Over time, atherosclerotic lesions can completely occlude the lumen by buildup of the plaque material and may contribute to thrombus formation. This is a chronic inflammatory disease involving many different cell types and driven by elevated levels of cholesterol in the blood. Atherosclerosis is a gradual buildup of fats, cholesterol, immune cells, calcium and other substances in and on the arterial walls. This buildup is called plaque. The plaque can cause arteries to narrow, blocking blood flow. The plaque also can burst, leading to a blood clot. When plaque builds up and the arteries become hard and inflamed, blood has trouble flowing through them to the rest of the body. This hardening of the arteries is usually a silent process in the early stages. There may not be noticeable symptoms for a long time, but eventually as the plaque grows, the opening or the lumen of the artery narrows, leaving less room for blood to flow. This means less blood can reach organs and tissues. This prevents organs and tissues from getting the oxygenated blood they need to function. And also, the constant force of the blood flow can lead to plaque erosion or rupture, causing a blood clot to form. Symptoms generally begin around middle age. In severe cases, it can result in coronary artery disease, stroke, peripheral artery disease, or kidney disorders, depending on which body parts the affected arteries are located in the body. Although arteriosclerosis is often considered a heart condition, it can affect arteries anywhere in the body. Arteriosclerosis is preventable and treatable, although not reversible. Healthy lifestyle habits can help prevent atherosclerosis. Causes of atherosclerosis. The exact cause of atherosclerosis is unknown and is to be multifactorial. High cholesterol, that is hyperlipidemia, especially high LDL, or high levels of a specific lipoprotein is the main contributing factor to atherosclerosis. Cholesterol is found naturally in the body and in certain foods. If cholesterol levels in the blood are persistently elevated, it may lead to artery clogging. Over time, cholesterol in the arteries become a hard plaque that starts to restrict blood circulation and may damage blood vessels, leading to blood clots. Blood clots may move through blood flow and travel to other regions of the body. When they block blood flow to vital organs like the brain, they can lead to serious complications. Other contributing factors for atherosclerosis may include aging. Age may also be a factor of atherosclerosis, but it doesn't mean significant atherosclerosis always goes hand in hand with aging. Male older than 45, female older than 55 is at risk of atherosclerosis. If atherosclerosis runs in the family, a person may have a higher chance of narrowing of the arteries. A person can inherit this condition as well as other heart-related problems. Lack of exercise. Regular exercise helps the cardiovascular system, including blood vessels, stay in optimal shape. It keeps the heart muscles strong and encourages oxygen and blood flow throughout the body. Low physical activity increases the chance of a host of medical conditions, including heart disease. High blood pressure, hypertension may damage the blood vessels by making them weak in some areas. Smoking, both active and passive smoking. Tobacco products may damage the blood vessels and heart. Diabetes. People with diabetes have a higher incidence of coronary artery disease. Next is metabolic syndrome. Metabolic syndrome is a group of conditions that together increase the risk of cardiovascular disease. They are type 2 diabetes and stroke. It can lead to other health problems as well, for example, atherosclerosis and organ damage. Unhealthy diet. Eating foods high in saturated fat, trans fat, sodium and sugar. Elevated levels of inflammatory biomarkers. Various inflammatory biomarkers have been associated with inflammation and are recognized as potential tools to monitor the progression of atherosclerosis. A well-studied inflammatory marker in the context of cardiovascular disease is C-reactive protein, which has been established as an inflammatory biomarker for atherosclerotic events. Lifestyle habits. Atherosclerosis develops slowly and it's often related to lifestyle habits including diet patterns and reduced physical activity, obesity, genetic factors. These factors can damage the artery's inner lining, that is endothelium. This causes atherosclerosis to begin. The damage usually occurs slowly and over time. Pathophysiology of atherosclerosis. Atherogenesis is the developmental process of atheromatous plaques. It is characterized by a remodeling of arteries leading to subendothelial accumulation of fatty substance called plaques. The inflammatory response involved with the development of atherosclerosis begins with the injury to the vascular endothelium and progresses over many years. The buildup of an atheromatous plaque is a slow process developed over several years through a complex series of cellular events occurring within the arterial wall and in response to several local vascular circulating factors. Injury may be initiated by smoking, hypertension, hyperlipidemia. One recent hypothesis suggests that for unknown reasons, leukocytes such as monocytes or basophils begin to attack the endothelium of artery lumen in cardiac muscle. As a result, inflammation leads to the formation of atheromatous plaques in the arterial tunica intima, a region of the vessel wall located between the endothelium and the tunica media. The presence of chronic inflammation within the wall attracts inflammatory cells such as monocytes, that is macrophages. The macrophages attacks lipids, becoming foam cells that transport the lipids into the arterial wall. Some of the lipid is deposited on the arterial wall, forming fatty streaks. Activated macrophages also release biochemical substances that can further damage the endothelium by contributing to the oxidation of low-density lipoprotein or bad cholesterol. The oxidized LDL is toxic to the endothelial cells and helps progression of the atherosclerotic process. Following the transport of lipid into the arterial wall, smooth muscle cells proliferate and form a fibrous cap over a cord filled with lipid and inflammatory infiltrate. Chronic inflammation within the arterial wall, driven by immune cells like macrophages, accelerates atherosclerotic plaque instability by promoting collagen breakdown and thinning the fibrous cap, which increases the likelihood of rupture and thrombosis. These deposits, called atheromas or plaques, protrude into the lumen of the blood vessel, narrowing the blood vessel and obstructing blood flow. Plaque may be stable or unstable depending on the degree of inflammation and thickness of the fibrous cap. If the fibrous cap over the plaque is thick and the lipid pool remains relatively stable, it can resist the stress of blood flow and vessel movement. If the cap is thin and inflammation is ongoing, the lesion becomes what is called vulnerable plaque. At this point, the lipid core may grow, causing the fibrous plaque to rupture. A ruptured plaque attracts platelets and causes thrombus formation. The bulk of these lesions is made up of excess fat, collagen, and elastin. A thrombus may then obstruct blood flow, leading to acute coronary syndrome, which may result in an acute myocardial infarction. When an MI occurs, a portion of the heart muscle no longer receives blood flow and becomes necrotic. Stages of atherosclerosis. The stages of atherosclerosis happen over many years and include endothelial damage and immune response. Damage to the endothelium triggers chemical process that cause white blood cells to travel to the injury site. These cells gather and lead to inflammation within the artery. Fatty streak formation. This is the first visible sign of atherosclerosis. It is a yellow streak or patch of dead foam cells at the site of endothelial damage. In this case, foam cells are white blood cells that consume cholesterol to try to get rid of it. Continued foam cell activity causes further damage to the endothelium. Plaque growth. Dead foam cells and other debris keep building up, turning a fatty streak into a larger pieces of plaque. A fibrous cap made of smooth muscle cells form over the plaque. This cap prevents bits of plaque from breaking off into the bloodstream. As the plaque grows, it gradually narrows the artery's opening, that is lumen. So there is a less room for blood to flow through. Plaque rupture or erosion. In this stage, a blood clot forms in the artery due to plaque rupture or plaque erosion. When the fibrous cap that covers the plaque breaks open, causes plaque rupture. With plaque erosion, the fibrous cap stays intact, but endothelial cells around the plaque will disappear or become thinner. Both events lead to the formation of a blood clot. The blood clot blocks blood flow and can lead to a heart attack or stroke. Symptoms of atherosclerosis. Atherosclerosis is a silent condition during its early stages, meaning it doesn't usually manifest with any evident symptoms until a significant blood flow blockage occurs. Mild atherosclerosis usually doesn't cause symptoms. Atherosclerosis symptoms usually don't happen until an artery is so narrowed or clogged that it can't send enough blood to organs and tissues. Sometimes a blood clot completely blocks blood flow. If the blood clot breaks, it may cause a heart attack or a stroke. The symptoms may include chest pain, pain in the leg, arm, and other regions supplied by the blocked artery, cramping in the buttocks while walking, heart palpitations, shortness of breath, fatigue, mental confusion if the blockage affects circulation to the brain, weakness and loss of sensation on one side of the body, that is hemiparesis, if the blockage affects brain circulation, muscle weakness and cramps in the legs from lack of circulation. It may be a noticeable symptoms of atherosclerosis if the artery is more than 70% blocked. Symptoms may be present in different parts of the body depending on the location of the blockage. Symptoms of moderate to severe atherosclerosis depend on which arteries are affected. If the atherosclerosis is present in the heart arteries, client may have chest pain or pressure called angina. Heart coronary artery disease happens in the arteries that supply blood to the heart. Client may experience shortness of breath, that is dyspnea during light physical activity, chest pain or discomfort, pain in the back, shoulders, neck, arms or belly, feeling dizzy or lightheadedness. Patient may have heart palpitations. Patient may be fatigued. Patient may have nausea or vomiting that may feel like indigestion. If the atherosclerosis happens in the arteries leading to brain with the carotid artery disease, the first symptoms are usually a transient ischemic attack or stroke. Client may experience sudden numbness or weakness in arms or legs, trouble speaking, slurred speech, sudden or temporary loss of vision in one eye or drooping muscles in the face, and severe headache. These are symptoms of a transient ischemic attack. If untreated, a transient ischemic attack can lead to a stroke. If the atherosclerosis is affected in the digestive system arteries, mesenteric ischemia happens when don't have enough blood flow in the parts of the digestive system. Client may experience pain or cramping in the belly, that is abdomen, after eating. Patient may have bloating, nausea and vomiting. Patient may have diarrhea. Patient may experience unintentional weight loss due to food fear. The patient may not eat because of the pain after eating. If the atherosclerosis affected in the arteries in arms and legs, patient may have leg pain when walking, that is called claudication. This is a symptom of peripheral artery disease. Also might have lower blood pressure in the affected arm or leg. Client may experience muscle pain, that is intermittent claudication. Patient may have burning or aching pain in the feet and toes when resting, especially when lying flat. Changes in skin color like redness. Cool skin on the feet. Patient may have frequent skin and soft tissue infections, often in the legs or feet. Patient may have sores on the feet or toes that don't heal. If the atherosclerosis is present in the arteries leading to kidneys, the patient may get high blood pressure or kidney failure. With renal artery stenosis, narrowing of the arteries that take blood to the kidneys, the patient may experience markedly elevated blood pressure that doesn't respond to multiple medications. Patient may have swelling, that is edema. Patient may feel drowsy or tired. The skin that feels dry, itchy or numb. Patient will have headache. Patient may experience unexplained weight loss. Patient may have nausea, vomiting, or loss of appetite. Early treatment can lower the risk of life-threatening complications. How is atherosclerosis diagnosed? To diagnose atherosclerosis or calculate the risk for developing it, a healthcare provider will perform a thorough physical exam. A physical exam is the first step toward diagnosing atherosclerosis. This includes using a stethoscope to listen to the heart and blood flow through the arteries. A medical professional may check for a weakened pulse, signs of an aneurysm or an abnormal bulging or widening of an artery due to weakness of the arterial wall. Slow wound healing, which may indicate restricted blood flow. A bruit or whooshing sound the blood makes as it travels through a blocker artery. For example, the provider will check the carotid artery in the neck for a whooshing sound called a bruit. This sound may indicate the presence of plaque. The healthcare provider may order additional tests to diagnose atherosclerosis and plan treatment. These tests may include blood test. Blood test can check blood sugar and cholesterol levels. High levels of blood sugar and cholesterol raise the risk of atherosclerosis. A C-reactive protein test also may be done to check for a protein linked to inflammation of the arteries. Next is electrocardiogram. This quick and painless test measures the electrical activity of the heart. Next is echocardiogram. An echo takes pictures of the heart's valves and chambers and measures how well the heart pumps. This test uses sound waves to show blood flow through the heart. It also shows the size and shape of the structures of the heart. Sometimes an echocardiogram is done during an exercise stress test. Next is exercise stress test. These tests often involve walking on a treadmill or riding a stationary bike while the heart's activity is watched. Because exercise makes the heart pump harder and faster than it does during most daily activities, an exercise stress test can show heart conditions. Next is Doppler ultrasound. This is a special ultrasound device to check blood flow at different points in the body. The test results show the speed of blood flow in the arteries. This can reveal any narrower areas. A Doppler ultrasound, which uses sound waves to create an image of arteries and would show a blockage. Next is angle brachial index, which looks for a blockage in the arms or legs. This test compares the blood pressure in the angle with that in the arm. It is done to check for atherosclerosis in the arteries in the legs and feet. A difference between the angle and arm measurement may be due to a peripheral artery disease. The angle brachial index is the systolic pressure at the angle divided by the systolic pressure at the arm. Next is cardiac catheterization and angiogram. This test can show if the coronary arteries are narrowed or blocked. A doctor places a long, thin, flexible tube in a blood vessel, usually in the groin or wrist, and guides it to the heart. The dye is inserted through the catheter to the arteries in the heart. The dye helps the arteries show up more clearly on the images taken during the test. A cardioangiogram, which is a type of X-ray that is taken after the heart arteries are injected with a radioactive dye to locate and measure blockages. There are two types of cardiac angiography, coronary CT angiography and left heart catheterization. Left heart catheterization is the passage of a thin flexible tube or catheter into the left side of the heart. Next is coronary calcium scan, also called a heart scan. A coronary calcium scan is a special computerized tomography scan of the heart. It looks for calcium deposits in the heart arteries. A buildup of calcium can narrow the arteries and reduce blood flow to the heart. A coronary calcium scan may show coronary artery disease before having symptoms. Tests can help diagnose atherosclerosis and find the cause. Results of the test are given as a score. The higher the calcium score, the higher the risk of heart attacks. Next is magnetic resonance angiography or positron emission tomography, also may be used to study the arteries. These tests can show hardening and narrowing of large arteries as well as aneurysm. A magnetic resonance angiography or computer tomography angiography which create pictures of the large arteries in the body. A chest X-ray takes pictures of the inside of the chest. CT scan takes the pictures of the inside of the body and can show any hardening and narrowing of the large arteries. Heart MRI test can show issues with blood flow in the arteries. Carotid ultrasound test takes ultrasound pictures of the arteries in the neck, that is carotid artery. It can detect hardening or narrowing of these arteries as blood flows to the brain. Abdominal ultrasound. This ultrasound takes pictures of the abdominal aorta. It checks for ballooning or abdominal aortic aneurysm or plaque buildup in aorta. Treatment of atherosclerosis. Common treatment goals include lowering the risk of blood clots, preventing complications like a heart attack or stroke, easing symptoms, help to develop patterns of eating that support the heart and blood vessels, slowing or stopping plaque buildup in the arteries, improving blood flow by widening the arteries or bypassing blockages. Treatment of atherosclerosis may include lifestyle changes such as eating a healthy diet and getting more exercise, medicines, heart procedure and heart surgery. For some people, lifestyle changes may be the only treatment needed for atherosclerosis. Lifestyle changes may lower the risk of complications. The healthcare provider will create a plan specific to the needs. General tips include avoiding all tobacco products, including smoking and vaping. Follow a heart-healthy eating plan. Build physical activity into daily routine. Now we'll see medications. Many different medicines can slow or even reverse the effects of atherosclerosis. Medicines that may be used to treat atherosclerosis include statins and other cholesterol medicines. These medicines can help lower low-density lipoprotein cholesterol, also called the bad cholesterol. The medicines also can reduce plaque buildup. Some cholesterol medicines even can reverse the buildup of fatty deposits in the arteries. Common statins include pravastatin sodium, simvastatin, atorvastatin, rosuvastatin, ezetimibe, simvastatin. Statins are a common type of cholesterol medicines. Other types include niacin, fibrates, bile acid sequestrants. Patient may need more than one type of cholesterol medicines. Next is antiplatelet medicines. These are medicines used to decrease the ability of platelets in the blood to stick together and cause clots. Examples of antiplatelet medicines are aspirin, clopidogrel, ticlopidine, and dipyridamole. Next is anticoagulants. It is also called blood thinners. These medicines work differently from antiplatelet medicines to decrease the ability of the blood to clot. Warfarin and heparin are examples of anticoagulants. Anticoagulants make it harder for blood clots to form in the heart, veins, and arteries. They also can keep existing clots from growing larger. Fibrinolytic therapy. It is also called thrombolytic therapy. Fibrinolytic therapy is most often used to treat heart attack and stroke, but it can also treat pulmonary embolism, acute deep vein thrombosis, acute arterial thrombosis, blocked catheters. Examples are alteplase, reteplase, tenecteplase. Next is blood pressure medicines. Several different groups of medicines act in different ways to lower blood pressure. Medicines to lower blood pressure don't help reverse atherosclerosis. Instead, they prevent or treat complications related to the disease. For example, some blood pressure medicines can help reduce the risk of a heart attack. There are several first-line or first-choice blood pressure medications. They include thiazide, These medicines remove extra water and sodium from the body, so there is less fluid flowing through the veins and arteries. This reduces pressure on the walls of the blood vessels. ACE inhibitors or angiotensin converting enzyme inhibitors. These medicines help relax blood vessels. They block the formation of a natural chemical that narrows blood vessels. Angiotensin II receptor blockers. These medicines block the action of angiotensin. Angiotensin is a chemical the body makes that narrows blood vessels. Next is calcium channel blockers. These medicines stop calcium from entering the cells of the heart and arteries. This allows the arteries to relax and open. Beta blockers. These medicines help the heart beat slower and with less force. Renin inhibitors. Renin is a substance made by the kidneys. It triggers a series of steps that increases blood pressure. Renin inhibitors slow how much of this substance is made. Medicines may be used to control other conditions that raise the risk of atherosclerosis. For example, is diabetes. Medicines also may be given to treat specific symptoms of atherosclerosis such as leg pain during exercise. Next is surgery or other procedures. If atherosclerosis causes a severe blockage in an artery, client may need a procedure or surgery to treat it. Surgery or procedure for atherosclerosis may include angioplasty and stent placement, also called percutaneous coronary intervention. This treatment helps open a clogged or blocked artery. A doctor inserts a thin, flexible tube called a catheter to the narrower part of the artery. A tiny balloon is inflated to help widen the blocker artery and improve blood flow. A small wire mesh tube called a stent may be used to keep the artery open. Some stents slowly release medicines to help keep the arteries open. Next procedure is endarterectomy. This is surgery to remove fatty buildup from the walls of a narrower artery. When the treatment is done on arteries in the neck, it is called a carotid endarterectomy. Next procedure is coronary artery bypass graft surgery. A surgeon takes a healthy blood vessel from another part of the body to create a new path for blood in the heart. The blood then goes around the blocker or narrower coronary artery. CABG is an open heart surgery. It is usually done only in people who have many narrower arteries. Next procedure is atherectomy, which involves removing plaque from the arteries by using a catheter with a sharp blade at one end. What are the complications of atherosclerosis? Atherosclerosis interferes with the normal workings of the cardiovascular system. It can limit or block blood flow to various parts of the body, including the heart and brain. Possible complications of reduced blood flow include carotid artery disease, coronary artery disease, heart attack, arrhythmia, that is abnormal heart rhythms, heart failure, mesenteric ischemia, peripheral artery disease, chronic kidney disease and kidney failure, renal artery stenosis, stroke, transient ischemic attack, aneurysms and rupture of blood vessels from weakened artery walls. Early diagnosis and treatment of atherosclerosis can help avoid or delay complications. Next, we will see the prevention, how to prevent atherosclerosis. Eat foods low in saturated fat, trans fat, cholesterol, sodium and sugar. Get regular physical activity. Keep a weight that's healthy. Manage any health conditions, especially diabetes, high blood pressure and cholesterol. Don't use tobacco products. Have a yearly checkup with a healthcare provider.